Hi, my name is Lisa Kruger, and I am a psychiatric mental health student with King University. And this week for our journal, we are challenged to recall a case where we have noticed opposition or difficulty in a patient's processing of information. And interestingly enough, that has occurred with a couple of patients that I was exposed to this week with my psychotherapy. One patient in particular, the first patient, was a patient who was preparing to discharge and had a home that they were scheduled to go to, and they lived alone, but they also have parents who are involved in their treatment, their care. So the difficulty that I was having while I was witnessing the psychotherapy interaction was watching the patient deflect and defer all of the difficulties that they were having without getting into detail, and blaming those difficulties on the parents who live out of state, and the level of acceptance for their own actions was non-existent. I can't even really say limited. So I felt that in my personal approach, I would have felt the need to engage in some motivational therapy and possibly some information about boundaries and accepting our own consequences, and addressing some obvious deflection and deference that I was seeing. And I realized, and I learned from watching the therapist, who is my preceptor, that it is and would have been a subject better saved for not acute therapy, and which is what we do at the inpatient facility where I'm employed. And he explained to me that this would have been almost negligent to point out and to begin without long-term cognitive behavioral therapy in place to continue that process, and explained that the role of this psychotherapy visit, due to the fact that it also that it was close to discharge, was to set this patient up with information regarding cognitive behavioral therapy, family therapy possibly, and motivational therapy, and to educate them about the purpose and direction and intended value of each of these therapies. So I learned quite a bit by his qualifying the type of visit and his ethical concern regarding what windows and doors, if you have what have you, that he was willing to open and address due to the nature of the reason for the visit. So it's very interesting. I've seen him do some psychotherapy and motivational therapy with other patients who he felt that he would be able to continue with, but learned that even if something is quite obviously what's happening, it's not always an appropriate time to address those situations, and it's ethical to refer and let people come to their own decisions about these things. So, like I said, this is my second video journal. My name is Lisa Kruger, and I appreciate your time.